Yeah, so we're going to talk about CIDP. We're going to talk about how we get to the diagnosis. We rely heavily on established criteria and guidelines by the EN, PNS that were updated in 2021. We're also going to talking about the different treatment that are available. Right now in the United States, you have IVIG, steroids, plasma exchange, and FcRn inhibitors. And each of those have their pros and cons. So depending on what works best for your patient, what you think the patient is most likely to want, and it's a shared decision. So the patient really and the clinician decide on what's the best treatment to start. So once you start treatment, what is very important is to make sure that there is objective response to treatment. So you want to see the patient improve. If they don't improve, then you want to reconsider the diagnosis or you want to change the therapy, either escalate it or switch to a different class of medication. Once you do that and the patient has an optimal response, then at that point you're going to start thinking, well, now the patient is doing really well. Am I over-treating? Am I under-treating? Or should I stay with the same treatment? Unfortunately, today we don't really have a lot of biomarkers or ways to tell whether we're over-treating the patient or not. Did the patient go in remission, for example, which they do in about 15 to 20% of the cases. So because of that, you're going to have to titrate the medication and tailor it really to the patient need. Perhaps spread the infusion or lower the infusion and see if the patient is maintaining function or not. So we're living in a very good area for people with CIDP and people who are treating them. We have obviously the complement. There's 3 different products that are being tested right now for CIDP. There's Claseprubart, Empasiprubart, and Riliprubart. All of those are being tested for CIDP to see if they provide benefit. There's hypercellated IgG. There's other FcRn that are being studied. People are looking into B-cell depletion. Some people have treated patients who are really refractory with CAR T. So it's a great area right now for study and research. And I think in the future we'll have exciting new products for our patients.